Hello friends, let's talk about basis of emergency medicine. How we approach the patient in emergency. Emergency patients are dealt in a different way because they differ completely from the outpatients and inpatients. As you know, the emergency patients needs urgent medical attention for what is perceived to be either an emergent condition or a medical need that they can't obtain help with elsewhere. So, the emergency physicians needs to be under the constraints of the limited time, limited resources, and seemingly endless line of the patients who are waiting to be seen. So, let's talk about the trials coding in emergency. First of all, the trials coding helps to give the idea about the emergency severity index. Okay, so trials coding is a emergency severity index, and which was developed by Richard Erie and David in 1998. Let's talk about the types of the trials. Okay, so we'll have a red, yellow, and green. Even orange and blue can be available, but in our center only red, yellow, and green trial system is present. Okay, so what sorts of the patients, emergency patients, are going to be kept in such categories? Okay, so in case of a red one, we admit very critical patient. Critical patients are kept in a red category, a red zone. Similarly, the yellow patient, in a yellow room or yellow trials, urgent patients are kept. Urgent. Okay. Similarly, in a green one, minor patient, minor severity scoring patients are kept. Okay. So now let's talk about the different steps that we are going to approach to the patient in emergency. So here are the steps. We'll encounter 7 steps to approach the undifferentiated person in the emergency. Okay. So let's talk about the first step. So first step, we'll do primary survey. In first step, we'll do primary survey. Okay. Hold on, guys. Primary survey. Okay. Primary survey. Primary survey. At the same time, we do the immediate interventions like immediate actions like ventilation, IV fluids for the significant hypotension, hemostasis for the hemorrhage, and chest compression if the patient is found to be pulselessness. Glucose or naltrexone for the altermental status and pain or fever control. Okay, so in primary survey, what shall we do? So first step 1 is primary survey. Okay, so in the primary survey plus immediate action is the first step. Immediate action. So in primary survey, what shall we do? So in primary survey, we'll be doing ABC. That is airway, breathing. C stands for circulation. So for checking airway, we'll check whether the patient is able to speak or not. Similarly, we'll check is their voice normal or high pitched. Or we can also say, like, are they displaying any signs of the imminent airway compromise? So we will check that features in airway. If the patient is able to speak, no doubt the airway is patent. Okay. So similarly, we'll be checking in the primary survey breathing. Is their breathing pattern rapid, like small respiratory distress? Okay. Are they grunting or audibly wheezing, or can you hear the stridor? Are they displaying any other abnormal breathing patterns or not. We'll be checking those things in breathing. Okay. Similarly, in the circulation, we'll feel the patient's pulse. We'll check the patient's pulse rate, character of the pulse. Similarly, we'll be checking the blood pressure and observe the skin color, whether there is cyanosis, pallor icterus, pallor. Okay, even icterus we can encounter. Similarly, we'll be checking for the vascular assays. Okay, so in this way, we approach to the patient in a primary survey. Followed by that, in a second step, we'll be doing the initial differential. We'll be keeping the differentials, So we did the primary survey, and for the immediate action, as per I have already told you, like the immediate actions after the primary survey, we'll be doing, like if there is a respiratory distress or shortness of breath, so we can do the ventilations. We can even do IV fluids for the significant hypotensions, right? And hemostasis for the hemorrhage, chest compression if pulse, glucose or naloxone for the altered mental status, and we can also keep or give pain and the fever controls drug. Similarly, in the second step, we'll be talking about the initial differentials. Differential diagnosis. Okay, so in this step, we'll enlist the possible diagnoses that are life or the limb threatening. This process initiated with the chief complaint and the primary survey and refined after getting more information. So this is also one of the initial assessment of the patient. Okay, so depending on the primary survey, the history, age and the look of the patient, the differential will definitely differ. Now let's talk about the third step. So third step is secondary survey. So we are not going to jump from primary survey to the secondary survey because in between them we'll be doing the initial differential diagnosis as per the history. Okay, so the third step will be secondary survey. So what shall we do in secondary survey? Ask the patient to give the history if possible, and focus the history in a different subheadings. Like you can ask about the chief complaint character, onset, location, duration, radiation, exacerbating or elevating factors, or associated symptoms, or different or the changes that has been occurred in the symptoms and the presentation during the prompt or the current visit. Okay, so we can learn that second survey in a we can have a mnemonic for this. Let me write with red. COLD, cold, READ. So is capital letter signifies some special words. Okay, so C stands for character, O stands for onset, L stands for location or the site, D stands for duration, R stands for radiation. Okay, and so E stands for exacerbating or alleviating factors, A stands for elevating factors, and D stands for the changes that has been made, or the we can say different today, whether the change in the pattern of the symptoms or the presenting complaints from to the current visit. Okay, so these are the way we can ask about the secondary survey. Means like we are going to elaborate the presenting complaints or the chief complaints in a very elaborated fashion in the secondary survey. Okay, so C stands for character, O stands for onset, L stands for location or the site, D stands for Duration. R stands for radiation, whether the symptoms is radiating to other site as well or not. Radiation. E stands for exacerbating or elevating. D stands for different today. Okay. Then after the secondary survey we'll be reaching to the fourth step. In the fourth step, even we can say, like in the secondary survey, we are going to explain, take the detailed type of history as far as possible, like explaining the chief complaints, and then taking the entire past medical history and the socio-economic history, family history, medication and allergy history, and focused history. Okay. And then in the fourth step, we are going to refine the differential diagnosis that we have made in the second step. Refine whether we are going to remove some of the differential as per the detailed detailed information. So refine the differential diagnosis. We can refine the differential diagnosis by removing the diagnosis from the initial checklist. Okay. And then in the fifth step, we are going to have diagnostic evaluations, guys. So how we are going to diagnose the disease? So for that, we are going to send the different types of investigations as per the history, in order to rule in and rule out the life-threatening diseases through the different types of the investigations. Okay. So in the diagnostic one, we are definitely going to send different types of investigations. You can send by investigation. We can write investigations for the diagnosis of the disease. Okay. Then sixth step is patient re-evaluation. Okay. In this step, the patient illness often manifesting or progressing and changing while in the emergency department. So we are going to re-evaluate the differential diagnosis in the sixth step. Then in the seventh step, we'll be treating the seventh step will be treatment and disposition. So guys, so after treatment or during the seventh step, we can either the patients in the emergency department can have the three dispositions. Like you can either admit the patient, or transfer the patient to some other hospital, eye care center, or discharge the patient after the recovery of the patient. So we have three dispositions. So this is about basis of emergency medicines, and in a couple of time we will be learning about the ACLS, BCLS. Okay. This much for now. Thank you.